Mechanisms of a spinal cord injury is most commonly independent of the sport that the athlete plays. Major mechanisms of cervical injury is adding excess load of weight on the top of the head, which is very dangerous because the neck is slightly flexed and the spine is being brought out of its normal alignment. This mechanism does not allow for proper distribution of force for the thorax. A fracture will result when the bone fragments, harenate, disc materials approach the spinal cord, which is in this case, neurologic damage will occur.
For assessment on the field, it is vital to first examine the level of consciousness, cognitive and memory processes, and cranial nerve function. Examination of airway, breathing, numbness, neck pain, and circulation is necessary because it could identify life-threatening injuries. Every unconscious and/or injured athlete who complains of pain should be stabilized and transported for further testing and diagnosis immediately.
When spineboarding and transporting the athlete should be properly secured to a rigid spineboard in a way that the cervical spine is immobilized and the airway is accessible. The best optimal position for the cervical spine to allow the maximum amount of space for the spinal cord would be to have the athlete at zero elevation with or without the equipment. Leaving the shoulder pads and helmet on football players is the best plan. Do not remove the helmet and leave the shoulder pads remaining on. That can cause
As the initial person on the scene stabilizes the athlete's head, the patient needs to be transferred to a spine board. This can be accompanied using a log roll or 6 people lifting, which is the lift inside the technique as demonstrated here. The athlete is being transferred using a log roll. First step is to coordinate the log roll, which the leader should coordinate the timing of the roll once everyone is in a position and stabilizing their designated body segment, then slowly rolling the person on the agreed upon side. After, the spine board should be at an angle. It's time is easier for the athlete to be transferred to the spine board. Once at the end of the count, slowly roll the person onto the spine board.
Although the general recommendation is to leave the equipment on, removing it is acceptable in certain situations, such as if after a reasonable time the face mask cannot be removed to gain access to the airway, or if the design of the helmet and chin strap is such that even after removal of the face mask, the airway cannot be controlled or ventilation provided, or if the helmet and chin straps do not hold the head securely such that immobilization of the helmet does not also immobilize the head, or if the helmet prevents immobilization for transport in an appropriate position.
Dysfunctions. The patient should be able to answer the following questions from the person in charge. It is a great way to detail the presence of the patient for any neurologic symptoms. Be sure to alert one to look for more evidence of the spinal cord injury. Any type of presence of symptoms should alert the examiner to any possible injury. Any athlete who is suspected of having neurologic involvement or vertebral column injury will need history, physical exam to have a complete radiologic evaluation.
When injured athlete arrives at hospital, the cervical traction with a device, such as Gardner well tongs, may be required for a bony reduction and maintenance of alignment in the neutral position. Radiographic assessments and examinations are necessary.
Cervical spine injuries in athletes can be prevented if the proper techniques and instructions are followed. Organized team sports have the advantage of ritualized training and competition phases compared with recreational sports. And strengthening exercises are very important in preventing cervical spine injuries. Improvements in equipment also helps.